The following program is rated G. It is suitable for all audiences.
Have you ever wondered how we survive in this world?
Did it ever cross your mind how we breathe and how our respiratory system works?
Be aware of the diseases of our respiratory system.
Do you know what will happen if we don't take care of our respiratory system?
Be surprised, for we will journey to the wonders of our respiratory system.
Sit back and relax, for this will be
A great adventure.
What are the parts of the respiratory system? Audio Jungle.
In order to stay alive, the body has to breathe air. We breathe in oxygen and we breathe out carbon dioxide. This process is known as respiration. Breathing happens automatically. Every day, the body breathes about 20,000 times. By the time we reach 70 years old, that's about 600 million breaths. All of this breathing occurs because of the respiratory system, which includes the nose, throat, voice box, windpipe, and lungs. At the top of the respiratory system, the nostrils bring air into the nose, where it's filtered, warmed, and moistened. Tiny hairs called cilia protect the nasal passageways and other parts of the respiratory tract and filter out dust and other particles that enter the nose through the breathed air. Air can also be breathed in through the mouth. The two airways of the nose and mouth meet up at the pharynx, which is located at the back of the throat. The pharynx carries both food and air and is used for digestion and respiration. One path is for food. This is called the esophagus, which leads on to the stomach. The other side is for air. It's called the trachea. A small flap of tissue, called the epiglottis, covers the air-only passage when we swallow. This stops food and liquid from going into the lungs. The larynx, or voice box, is located at the top of the trachea, the air-only pipe. This is where our vocal cords are. The trachea, or windpipe, which is a 2 to 3 centimetre tube, then extends downwards from the bottom of the larynx for about 12 centimetres. The walls of the windpipe are made strong by stiff rings of cartilage that keep it open. The trachea is also lined with tiny hairs. They sweep foreign particles and fluids out of the airway, keeping them from entering the lungs. The windpipe divides into two branches, and each one of these enters one of the two lungs of the body. Each branch resembles the limbs of a tree dividing into smaller, finer branches called bronchioles. The bronchioles end in tiny air sacs called alveoli, which look a bit like grapes. These structures enable fresh air to get to the air sacs, which are surrounded by tiny blood vessels, or capillaries. The oxygen passes through these air sacs and travels through the capillary walls into the bloodstream. At the same time, carbon dioxide transfers from the bloodstream into the air sacs, where it gets breathed out of the body. When we exercise, the body needs more oxygen to feed the muscles as they work harder. The body responds by breathing more quickly and deeply. As the cells of the muscles use up more oxygen, the lungs have to work harder to keep up the supply. The respiratory system then speeds up to supply the body with much needed oxygen, and also to get rid of the carbon dioxide waste in the system. Over time, exercising also helps our chest cavity to get bigger, which enables the body to increase the amount of air it takes in. More capillaries form around the air sacs, so the body gets better at swapping oxygen and carbon dioxide gases. We can see how the body's respiratory system helps the body to move about, and is influenced by regular and ongoing physical activity as well.
This lecture is going to cover the respiratory system's major structures and functions. Now, concerning the respiratory system, its major function is gas exchange, getting oxygen from the outside air into your lungs and then into your body for proper cell function, and then the vice versa, getting the waste gas product, carbon dioxide, from your body into your lungs to leave your body. Of course, this works with the circulatory system because it's the blood that carries both the waste, carbon dioxide, and the oxygen throughout your body. Now, most of you are familiar with the major structures, especially the external ones. So through both your nose and your mouth, which is not mentioned on this slide, these are both structures on your face. Of course, your nose consists mainly of those two nostrils, right? Your mouth you're all familiar with when we're talking about things that you eat, talk through, etc., etc. Both of these are where air enters into your system and leaves from your system. Now, your pharynx is the fancy way of saying throat, and this is what connects the nose to your larynx, the next structure within your respiratory system. So air starts in your nose and your pharynx, nose and mouth, and it goes to your pharynx, and then it goes to your larynx. This is the fancy way of saying your voice box, and it is the piece that connects the pharynx to the trachea. Now, your trachea is also known as your windpipe. If you ever look at the structure, especially when we get to the part where we dissect pigs and stuff in the class, you'll see that the trachea is a very whitish looking structure, and it's sort of ridged looking. And so it always makes me think of like when you go to Six Flags or some other amusement park or a gas station and you get those big thicker straws that go with the like big gulps and stuff like that, and they kind of have the ridges on them. It's almost what a trachea looks like. But this connects the larynx, so your voice box, to the next structure in your respiratory system, the bronchus. Now, bronchus is the singular. The trachea leads to the bronchus, one of two bronchus. Plural, they're called bronchi. And these are the main tubes that run from the trachea into the bronchioles. Since it branches off into two bronchi, right, each one goes into either your right or your left lung. Right, and they kind of continue to divide up into different levels, secondary, tertiary, etc., until you get to bronchioles, right? And the bronchioles are just much smaller tubes, and again, it continues to branch and web out. These are made of smooth muscle, and they carry on and continue to break down into smaller and smaller tubes. And so as these bronchioles keep dividing and dividing, they finally end in these structures called alveoli. Now, these are air sacs in your lung. It's at the end of each one of all of these finite branching of the bronchioles. And this is where gas exchange actually takes place, where the process of respiration takes place. If you look at this picture, you'll see that the alveoli, it's the picture in the top right, are covered in blood vessels, completely covered, and that's because that's where respiration takes place. You've got to get that gas exchange of the oxygen that you've breathed into your lungs from those alveoli, those air sacs, into the bloodstream. And the reverse process, you need to get that waste product, carbon dioxide, from your bloodstream into the lungs so your body can get rid of it through exhalation. And again, these are all structures, these are all within the lungs. The lungs, of course, are your major organ in the process of respiration and ventilation. And again, like I say, there's a right and a left, and that's why you have the division of the bronchi from the trachea. And you can see a nice diagram of that in the bottom right hand of it.
In life, there are many vices and temptations. These can destroy you or even kill you.
Audio Jungle.
You know that smoking is bad for your body. You also know that the longer you smoke, the worse it is for your body. But what you may not know is how good it is for your body to quit smoking, and that the longer you go without smoking, the healthier your body becomes. After only 20 minutes from your last cigarette, your blood pressure, pulse rate, and the temperature of your hands and feet all return to normal. After 8 hours, the nicotine in your bloodstream reduces by 93.25%. After 12 hours, your blood oxygen level increases to normal, while your carbon monoxide level drops to normal. After 24 hours, your quitting-related anxieties peak and will return to pre-quitting levels within 2 weeks. After 48 hours, damaged nerve endings are regrowing, and your sense of smell and taste are returning to normal. At this time, your quitting-related anger and irritability peak. After 72 hours, you are 100% nicotine-free. Your withdrawal symptoms already peaked, the bronchial tubes in your lungs are relaxing, and you're now breathing easier. After 5 to 8 days, you're having an average of 3 cue-induced cravings each day, and no craving lasts longer than 3 minutes. After 10 days, you have less than 2 cravings a day, each less than 3 minutes. After 2 weeks, the blood circulation in your gums and teeth are similar to a non-smoker. After 2 to 4 weeks, your quitting-related anger, anxiety, impatience, insomnia, restlessness, and depression are gone. After 2 weeks to 3 months, your risk of heart attack is dropping and your lung function is improving. After 3 weeks to 3 months, your circulation is improved, your chronic cough disappeared, and you are walking easier. After 9 months, your sinus congestion, fatigue, and shortness of breath are decreased. The cilia in your lungs, which keep your lungs clean, are regrown, and you have increased energy. After 1 year, your excess risk of coronary heart disease, heart attack, and stroke are now half the excess risk of a smoker. After 5 to 15 years, your risk of having a stroke is the same as a non-smoker. After 10 years, your risk of lung cancer is 30 to 50% of a smoker's risk. Your risk of death from lung cancer is reduced by half, and your risk of pancreatic cancer is the same as a non-smoker. Your risk of mouth, throat, and esophagus cancer is also reduced. After 13 years, your risk of tooth loss is the same as a non-smoker. After 15 years, your risk of coronary heart disease is the same as a non-smoker. After 20 years, the risk of death from smoking-related causes is now that of a non-smoker.
You know, we've talked a lot about how breathing works, but before we end the show, I want to share with you some healthy hints. First of all, it's very important that when you breathe, your belly move in and out a little bit. Don't force it, but remember, your diaphragm is dropping down and moving up, which pushes your belly in and out. Also, keep your body straight, not stiff. Don't hunch over. Give your lungs the room they need. Your lungs deserve the very best, so every girl and boy, take good care and stay aware that breathing is a joy. Breathing is a joy.
What diseases can we get if we don't care of our respiratory systems?
Audio Jungle.
Oh, not there! Not there! Not there! What is his problem?
He fainted.
Let me check. He has asthma.
inflammation is one main cause of asthma. It's often the hidden cause because you might not notice it. In normal lungs, air freely gets in and out of your airways, but either internal factors or things you breathe in like allergens, cigarette smoke, or irritants can make your airways become swollen or inflamed, kind of like how allergies in your nose can make you feel congested and stuffy. Inflammation can cause troublesome symptoms or asthma attacks, but medicines like inhaled corticosteroids that you take every day can help reduce or prevent this cause of asthma. Next is bronchoconstriction, or squeezing of the tubes in your lungs. I know, it's a pretty long word, and it's no fun either. Bronchoconstriction is the cause of asthma symptoms that you might feel as tightening in your chest. In a normal airway, like you see here, the muscles around the tubes in your lungs are relaxed. This lets air in and out freely when you breathe. But with asthma, the muscles might be twitchy and squeeze. Some people say it feels like breathing through a straw. Short-acting inhalers, which often contain medicine called albuterol, are used for the temporary relief of asthma symptoms. Albuterol acts on the bronchoconstriction part of asthma. When you inhale this medicine into your lungs, the muscles that are squeezing the airways can relax a bit. This makes it easier for air to get in and out, and that's a good thing when you're having asthma symptoms. Now you know the two main causes of asthma. For more videos and information like this, visit us at allergyasthmanow.com.
Hi everybody, this is Dr. Don Kennedy from IQuitSmokingFacts.com in my family practice with Pat here, who has a little message for you. Some of you are young smokers, some of you are old smokers, some of you don't think you can quit, and some of you don't want to quit. Pat here is going to tell you the truth. You need to listen to this because her story should make you want to quit because she wants you to quit. Isn't that right, Pat?
That's right.
So you started smoking when?
When I was 13 years old.
Who gave you the cigarette?
I stole them from my mother.
Your mother was smoking?
Yes.
So, and then you smoked from 13 years old till when?
Till 1990.
90. But what happened? Why'd you quit?
They put me in the hospital. I had pneumonia.
Yeah.
And they put me in the hospital and they told me they were going to put me on a machine and let the machine do my breathing for me because I couldn't breathe.
Right.
And when they told me that, I said, no way. I'll never take another cigarette. And I never smoked another cigarette.
But you've had some troubles.
Oh yeah. I've got emphysema, I got bronchial asthma, I have asthma. I'm on oxygen 24/7. It's really bad. If I had a choice, I wouldn't have never started smoking. But I'm telling whoever, look at me, don't smoke a cigarette. Because look what happens when you smoke cigarettes.
You know what? I'm not even going to quantify that message. Go to IQuitSmokingFacts.com right now and see how it is that I get people in my medical practice and all over the world now off of nicotine because you need to quit cigarettes right now.
Early lung cancer typically does not cause symptoms. As the cancer grows, you may experience symptoms such as a cough that gets worse or does not go away, shortness of breath, chest pain, and wheezing. Other symptoms of lung cancer include coughing up blood, hoarseness, weight loss without trying, and frequent lung infections, such as pneumonia. Other health problems may cause these symptoms. You should see your doctor if you have any symptoms you're concerned about.
Chronic obstructive pulmonary disease kills over 100,000 Americans each year, making it the fourth leading cause of death in the United States. So what exactly is chronic obstructive pulmonary disease?
Actually, chronic obstructive pulmonary disease, or COPD, refers to two different diseases of the lung, emphysema and chronic bronchitis. Since emphysema and chronic bronchitis are each usually caused by years of cigarette smoking, afflicted individuals are almost always diagnosed with both at once, hence the umbrella term chronic obstructive pulmonary disease. This combination of diseases can also be caused by years of inhaling a variety of industrial toxins, fumes, and chemicals. Prolonged exposure to air pollution and secondhand smoke, or even a history of childhood lung infections, can also lead to COPD. However, since chronic bronchitis and emphysema affect two different parts of the lung, let's take a separate look at each of these diseases. Chronic bronchitis is characterized by an inflammation of the bronchial tubes, which are passageways that branch off from the trachea or windpipe and allow air to enter the lungs. This inflammation causes thick mucus to build up in the tubes, preventing sufficient air from reaching the lungs. Emphysema occurs when the walls between the air sacs in the lungs, known as alveoli, lose their elasticity. This, in turn, causes the air sacs to become fragile and overinflated, leading to an unnatural retention of air within the lungs. The symptoms of COPD tend to depend on which disease is more prominent in an afflicted individual. If emphysema is the predominant disease, the first notable symptom will be a shortness of breath during physical exertion. This will soon be followed by a phlegmatic cough and pursed lip breathing. If chronic bronchitis predominates, a persistent mucus-filled cough will often be the first symptom to appear. This may be accompanied by wheezing, shortness of breath, fatigue, and respiratory or lung infections. COPD is usually diagnosed based on an individual's medical history and an examination of his or her lungs. This lung examination can be done with chest x-rays, CAT scans, and any number of pulmonary function tests such as spirometry. A spirometer measures the inhalations and exhalations of the lung and the efficiency of their ability to transfer oxygen to the blood. There is no cure for chronic obstructive pulmonary disease. However, its destructive presence can be controlled and slowed with close medical attention, allowing those afflicted to lead longer and healthier lives. If you are concerned that you may have COPD or are experiencing symptoms of either of its component diseases, please see your doctor or pulmonologist for a checkup immediately.
Want to learn more? Check out other videos and sources on this site for more information.
Treatment options for cancer include local therapies, such as surgery and radiation therapy, and systemic therapies, such as chemotherapy and targeted therapy. You may receive one or a combination of these treatments. There are several surgical options, depending on the type and stage of the cancer. During a wedge resection, or segmentectomy, the tumor and a small margin of healthy tissue are removed. In a lobectomy, or sleeve lobectomy, one lobe of a lung is removed. During a pneumonectomy, the surgeon removes the entire lung. In a sleeve resection, a diseased section of a large airway is removed, and the healthy ends are reattached. During any of these procedures, your surgeon may remove lymph to check them for signs of cancer. Radiation therapy or radiotherapy is a local treatment that uses high-energy rays to kill or shrink cancer cells to relieve symptoms. External beam radiation therapy is directed at the cancer's location from a machine outside your body. Brachytherapy, or internal radiation therapy, often in the form of pellets, is most commonly used to help relieve blockage of the large airways by cancer. Chemotherapy is a systemic treatment that uses drugs to stop the growth of the cancer cells by either killing them or inhibiting their cell division. Once the drugs enter the bloodstream, they can travel and reach cancer cells throughout the body. Targeted therapies are newer cancer treatments that work by focusing on specific genetic abnormalities of cancer cells. One targeted therapy, bevacizumab, starves the tumor by stopping it from creating a new blood supply. Another targeted therapy, erlotinib, stops tumor growth by blocking the chemicals that signal the cancer cells to grow and divide.
Dinesh asks, what is the success rate for treating lung cancer with chemotherapy, radiation, and surgery? Are there alternative lung cancer treatments that do not use chemotherapy, radiation, or surgery? What is chemotherapy? Marina?
It's been said that statistics is the only field where two people can draw different conclusions from the same set of data. For example, chemotherapy's estimated efficacy rate is 3 to 80%. This wide gap depends on whether you are using the 5-year survival rate defined by the American Cancer Society or the total life survival rate. So what is chemotherapy? It is a cancer treatment that uses drugs to stop the growth of cancer cells, either by killing the cells or by stopping them from dividing. It was invented around World War II from the poisonous nerve gas called mustard gas. It is very difficult to discuss any success rates for treating lung cancer with chemo, radiation, surgery, or a combination of those because it depends on many variables: type and stage of cancer, its location and size, the age and health of the patient, and so on. Very generally, for non-small cell lung cancer, 5-year survival rate varies from up to 80% at stage 1 to less than 1% at stage 4. For small cell lung cancer, same rate for limited stage is about 10% and none for the extensive stage. So basically, the success in curing lung cancer is dismally low. Even with early detection and screening programs for lung cancer, many studies show no significant survival benefit. And since the majority of lung cancer is diagnosed at a relatively late stage, only about 10% of all lung cancer patients are ultimately cured. There is a large variety of alternative lung cancer treatments. They include various therapies, biological and pharmacologic, immunology, herbal, nutritional, metabolic, adjunctive, including oxygen therapies and hypothermia, energy medicines, mind-body approaches, acupuncture, hypnosis, massage, meditation, yoga, and many others. The most successful practitioners seem to be those who integrate various components of these alternative cancer treatments listed above without committing to a single model. And one pearl of wisdom before we are done. The best hope of limiting lung cancer is prevention. Avoid exposure to carcinogens, which are agents that cause cancer. You know what I'm talking about? Quit smoking. As always, if you want a transcript of this video, click the Show More button below.
I'm hoping that all you ncognitive.com viewers will live happy and eat healthy. Go out and enjoy the sunshine. Get your vitamin D. It's good for you. I know Marina is not getting enough up in that library.
smoking is prohibited here at the Santo Tomas University. Take care of your lungs, take care of your life.
Thank you for watching.
Cut.
Alright.